Pnawn da. Nitydd Cenedlaethol.
Good afternoon. The National Assembly for Wales is called to order. Item 1, questions to the First Minister. Question 1, Mohammed Ashkar.
Madam Presiding Officer, First Minister and my colleagues, Happy New Year to you all from myself and from this side of the chamber. Will the First Minister outline his priority for improving HNS services in Wales in 2015, please?
Can I thank the member for his good wishes and reciprocate them, of course, and to all members in the chamber. Can I say our priorities for improving NHS services for 2015 include our wish to increase the focus on improving population health and well-being, to pursue further the prudent healthcare and integration agendas, and to increase the services the NHS is able to deliver outside of the hospital setting.
Thank you for the reply, First Minister. Accident and emergency waiting time in Wales haven't been met in over 5 years. Ambulance responses time are at their lowest since 2011. 1 in 7 people are on waiting lists for treatment, and patients are denied access to cancer drug fund. Your party claims that the NHS in Wales, in England, is in crisis. How would you describe the state of NHS in Wales under your government, please?
I do not believe that Offa's Dyke is the line between life and death. I think that is the most unfortunate turn of phrase. Can I say that there have been huge pressures on the NHS across the whole of the UK over the past few weeks, and that is true of Wales and England, Northern Ireland and in Scotland. I want to pay tribute to the NHS staff who have dealt in difficult circumstances with those pressures, and their dedication and professionalism is very much to be commended. It's right to say that there has been great pressure on A&E. The difficulty with A&E is it's a demand-led service. It can be quite difficult to predict what the demand will be, although our winter plans are holding up in terms of there not being widespread cancellation of surgery, widespread cancellation of outpatients appointments, but there are great pressures there. But it does show that those pressures exist across the whole of the UK, and really the NHS should not be a political football. And that is true of the Welsh NHS as it is of the English NHS.
Anne Jones.
Thank you, Presiding Officer. First Minister, I've mentioned in this chamber many times the pleasing A&E quadrant, the new emergency quadrant based at Glenclwyd. And together with the announcement last week from your government ministers around the rollout of a new emergency department clinical information management scheme, which will help to improve, I think, some unscheduled care services by streamlining flows of information about patients. I think that will be of great interest to many members and many constituents, with A&E performances and data being very much in the spotlight across the UK. What impact do you think that the additional capital spending that this government's put in recently will have on a patient experience?
Well, investment in a national emergency department clinical system will help to improve unscheduled care services by streamlining the flow of information on patients and cutting down on paperwork for healthcare professionals. Frontline medical staff in the emergency departments using the system will also be able to have instant access to details of a patient's previous A&E visits, and so information will be shared that much more quickly, and of course the response to an individual patient's needs will be quickened as a result of that.
Ellen Jones. No. Peter Black.
Thank you, Presiding Officer. First Minister, the Cardiff and Vale Health Board provide services for neuroendocrine cancer patients, for those patients living in the Cardiff area. But there is no Wales-wide service, and patients outside of Cardiff do not have access to that service, as confirmed to me by the Health Board late last year. What plans do you have to commission through the Welsh Health Specialised Services Committee a Wales-wide service for those patients who suffer from neuroendocrine cancer?
Well, of course, hospitals such as Velindre provide a service far more widely than Cardiff. The member has raised a specific point with regard to a specific condition, and I will ask the Health Minister to write to him with further detail.
Mick Antonib.
First Minister, the Tories' flagship Cancer Drugs Fund continues to be criticised by clinicians and researchers, and now even pharmaceutical companies. And the Welsh Tories, as part of their contributory role to the war on Wales, continue to champion the fund, which has been described by clinicians as unethical, discriminatory and a cheap political fix. Does the First Minister stand by his decision that a similar fund in Wales will not be introduced?
Yes, we take the view that there should be equality of access to treatments regardless of condition. The problem with the Cancer Drugs Fund is that it discriminates in favour of those who have cancer and others who have equally life-threatening conditions. We know that it has dealt with drugs that are not life-saving drugs, although, of course, depending on the individual, they can extend life by weeks, sometimes months. That much is true. But we now see, of course, drugs being taken out of the Cancer Drugs Fund in England. We see the publicity that's engendered today and the criticism of the Cancer Drugs Fund itself. We take the view that there should be a system of funding that is fair and equitable to all people, regardless of their condition.
Question 2, Rheniap Iorwerth.
Diolch Llywydd, a
Thank you, Presiding Officer. Will the First Minister make a statement on Welsh Government investment in the Anglesey Circuit?
Well, the funding has been provided to the circuit via a European funding programme through a tourism grant.
And I'm grateful for that investment, and I'm sure that we would all wish anyone wanting to invest their own money in a new racecourse or racetrack in Wales, and there is talk about development in Ebbw Vale, and we welcome that, but there is concern that increasing capacity in Wales could actually have an impact on resources available already, and we certainly wouldn't want government investment in a new resource to undermine investments that they have made elsewhere, such as the Anglesey Circuit. Does the First Minister share that concern, and does he also agree that what would be sensible would be to have further public investment possibly in the Anglesey Circuit to ensure that that remains competitive, to protect government investment and hopefully towards attracting the Wales GB rally there?
Well, I would say that we've already done that because a grant was awarded in 2010 which ensured that the facilities would be improved, and of course 1.3 million which has been given through the project track and the RDF. I visited the track itself, the circuit itself. I've had the experience of being driven in a Ferrari around that circuit, which is a very worthwhile project. I don't know whether Rhyn has had the same experience. It's not a very comfortable thing to have to get into that car for the first time, but that track has been very, very successful. We want to support the Anglesey Circuit in the best way possible.
Greg Sandbach.
Well, Minister, I've been fortunate enough to take my own car around the circuit, but I can assure you that it wasn't a Ferrari. It wasn't a Ferrari. No, it certainly wasn't a Maserati either. It was an MG, a good British make at the time. First Minister, Rhyn ap Iorwerth makes an important point that there is a danger that investment elsewhere, and there's talk of some £30 million of Welsh Government money, may undermine existing facilities and indeed take investment away from North Wales. Whilst, of course, 1.3 million is a welcome investment, much of that was private investment, or at least matched by private funds. And I would ask that you consider the impact on the economic ability of the Anglesey track to be able to generate its income and compete if the Ebbw Vale track gets substantial sums of government money.
There is no question of investment in one part of Wales crowding out investment in another. There is room, I believe, for both. They are far enough apart in that sense. Trackmorn has been very successful. We've been supportive of it, and we look to be as supportive as we can be of it in the future.
We now move to questions from party leaders, and first this afternoon we have the Leader of the Opposition, Andrew Archie-Davies.
Thank you, Presiding Officer. First Minister, we all witnessed the horrific events last week in France, and it was deeply moving to see the outpouring of grief, but also support that all parts of the globe, and in particular here in Wales, offered the French people in such a dark hour. The terrorist situation and the radicalisation of some sections of communities is a constant worry for many people. I know in your role as First Minister at the JMC a briefing was given about the situation that the security services believe to be existing at the moment. We know from stories that sadly people from Wales have fallen under the misapprehension that if they go out and serve a certain cause in the Middle East, they are doing justice to their beliefs. What do you think the threat level is at the moment that faces communities and the people of Wales?
It's not for me to assess the threat level. He will understand, of course, we did have a briefing in the JMC. It wouldn't be appropriate to reveal the details of that briefing. It's a matter for the UK government, of course. This is a non-devolved matter, and correctly so, in my view. But it does, the events in Paris do show us there is a need to be vigilant at all times. These attacks can come out of nowhere. They are a handful of people. They are a handful of people. We must bear in mind, of course, they are in no way representative of the Muslim community in Wales or anywhere else. And of course, there is a sad and tragic irony in the fact that one of their victims, policeman, was himself a Muslim. And so we must resist, of course, any attempts by some on the very fringes of politics to suggest this is some kind of battle between Islam as a whole and other belief systems. It's far from that. Can I say I was very honoured to be on the steps of the Senedd on Sunday evening to join many, many others to show solidarity with the employees of Charlie Hebdo and, of course, with the people of France. And it shows that there are very many millions of people of all religions and none who will stand up very strongly against terrorist outrages such as this.
Thank you, First Minister, and I endorse and hopefully stand shoulder to shoulder with the sentiments that you've expressed in your answer to me on the first question. And it is right that the security service and the police, which aren't devolved responsibilities, obviously deal with this on a day-to-day basis. But many of the services that are funded from the Welsh Government, whether it be in education, whether it be community support, obviously do have a role and input from the Welsh Government in reaching into communities. And some of the commentators obviously have pointed out that we need to be addressing why people feel so marginalised in society, that they do feel seduced by the radicalisation agenda that is put forward by some people. Given your understanding of the situation we face, do you think that there is more that the Welsh Government can be doing, working with its organisations that it sponsors in the community, or indeed via the education system, so that people do not feel marginalised and seduced by this radical agenda that some, a very small minority, feel that they want to subscribe to?
Yes, we have a good relationship with the Muslim Council of Wales. I personally chair the Faith Communities Forum, and certainly that has been invaluable over the years in ensuring that community tensions don't surface, and also in ensuring that where there is a potential problem with certain individuals, as far as possible, that problem is identified. It can never be perfect, of course, and we know that from the recent months. Yes, of course, there is a role for devolved bodies. I know that Leighton Andrews, as Minister, has met with James Brokenshire to discuss how devolved and non-devolved bodies can work together. And that meeting was a meeting that certainly led to a greater understanding of how we can move forward together to face this common threat.
One of the simplest ways, obviously, that would support many people in communities who feel under pressure about radicalisation is the line of communication. And very often, the security service and the police are very often seen as maybe the last resort because of the seriousness of the situation. What would be helpful, I would suggest, would be an element of communication that could be developed within the community that could be seen as a first point of contact, whether that be in the education system or the community-based volunteers that could identify actions that they think could lead to radicalisation of young people, or the promotion of ideas that could lead to events such as we saw in Paris over the last couple of days. Are you confident that the lines of communication that we have at the moment meet those goals, or do you believe that we can set up a different way of responding to some of the concerns that some people find themselves facing in this new climate of radicalisation?
I think they're as good as they can be. There is always scope, of course, to see how things can be improved, but the Faith Communities Forum is certainly important. The strong links that we have with representative bodies of the Muslim community are important. And of course, there's the Civil Contingencies Forum that I chair as well, which looks at it from a different perspective, a security perspective rather than a community's perspective. Of course, representative bodies of the Muslim community cannot, by their very nature, represent those people who stand outside of those bodies. A handful of people who are radicalised, who are more extreme in their views, And then, of course, it's a matter for the security services to help to identify them and, of course, to take action to make sure that they are no threat to either the society around them or, indeed, the Muslim community itself. But we're always open, of course, to discussions, and we have regular discussions with the UK authorities and with the police to make sure that the system is as robust as it can be.
We now move to Leader of Plaid Cymru, Leanne Wood.
Diolch Llywydd a blwyddyn newydd dda.
Thank you, Presiding Officer, and Happy New Year to you all.
Love you. First Minister, just a few weeks ago, your Minister for Communities and Tackling Poverty said, and I quote, "The reality is the UK government's changes are risking the safety of vulnerable people. They are squeezing the income of families and individuals who are already struggling to make ends meet." Last week, the Wales Audit Office showed that people in Wales had suffered disproportionately as a result of attacks on the welfare state. Do you agree with Plaid Cymru that austerity, by any measure, has failed?
I think the current programme of the UK government has failed. There's no question about that. I think the welfare system is not working in the form it should in terms of redistributing money across the whole of the UK, even though I know it's devolved in Northern Ireland. The reality is it's financially very much part of the UK system. And I very much regret that there has been a certain amount of targeting of those who are most vulnerable. And the bedroom tax, of course, has been an example of that.
First Minister, it's inexplicable that you won't miss a single opportunity to come here and attack Tory policies, yet you're reluctant to condemn austerity, which is the heart of the very problem. 1 in 3 children in Wales live in poverty. There's been a 20% increase in the numbers of people using food banks. You know that local services in some cases are being totally withdrawn. The number of tenants in arrears has rocketed by over 23% because of cruel welfare reforms. All of this is from austerity, which has failed, and it has failed badly. Can you explain then, First Minister, why your MPs, Labour MPs, will be today voting in favour of the Tories' austerity charter in Westminster later on?
I am the First Minister of Wales and a member of the National Assembly for Wales. What happens in Westminster happens in Westminster. I take the view, I'm afraid, that I am responsible for answering questions on behalf of the Welsh Government and not the Labour Party elsewhere in the UK. I take the view, however, that much of what she has said is correct. I think what has been put before the Welsh people over the past 4.5 years, has been the wrong approach. I don't think we're in the position we were in even in 2010. We are worse off. We see the effect on individual vulnerable people. We see the effect on the Welsh budget, and we as a government will do all that we can, given the current powers that we have, to cushion the blows that are falling on the people of Wales as a result of the policies of the last 4 years.
You know full well, First Minister, that what happens in Westminster has an impact in this place here. And the motion and the austerity consensus that your party and your party leader are supporting today will mean further deep and damaging cuts. And it will also mean that the eventuality of any recovery will be strangled too. You've refused to distance yourself from that. Week in, week out, you come here and bemoan Tory cuts. Isn't it the truth, First Minister, that you were trying to look both ways on austerity? Isn't it the truth that if you were in Westminster today, you would be voting with the Tories? You may favour Labour austerity to Tory austerity, but the truth is that you still favour austerity. Isn't that the case, First Minister?
I can assure the Leader of Plaid Cymru that I have no desire whatsoever to go to Westminster. So she will not find me voting in the House of Commons. What I can say to her is this: there is a general election in May. The people of Britain will have the opportunity to choose which party, or parties even, they would wish to see governing the UK. I believe that my party at the UK level will put forward a fair, socially just manifesto that will look to grow the economy of Britain in the fairest way possible, and that is what the message will be to the people of Britain, because that is the message we've promoted in Wales for the past 4 years.
We now move to the Leader of the Welsh Labour Democrats, Kirsty Williams.
First Minister, what analysis has your government carried out in recent weeks to ascertain the nature of demands being placed upon Wales's accident and emergency admissions departments? And wouldn't you agree with me, whilst of course it is right to urge people not to go to A&E if they don't need to be there, are you truly suggesting the fact that 82% of people are seen within 4 hours is down to inappropriate people being at the A&E department, or is it down to more complex demands?
Complex, I think, is the word. It is right to say that there still remain a number of people who shouldn't be going to A&E. That much is true, and there's no point trying to deny that. That's correct. That said, the pressures that we have seen across the whole of the UK in the last few weeks have been down to a number of factors. One of the major factors has been the appearance of a flu strain that was not foreseen by anybody, that wasn't part, I understand, of the vaccination that was available this year to deal with flu, and that of course has a knock-on effect across the whole of A&E. As I said earlier on, the difficulty with A&E is trying to predict the level of demand when that demand is unforeseen if, for example, a new strain of flu appears. Of course, planning was put in place months beforehand in terms of the winter plans of the local health boards. Those plans have by and large held. We're not seeing a situation where large numbers of operations are being cancelled. We're not seeing a situation where large numbers of outpatient operations are being cancelled. But of course, I fully acknowledge the huge demands that have been made on A&E across the whole of Britain in the past few weeks.
It's interesting, First Minister, that Wales' figures show that just 83% of people are seen within 4 hours. Your colleagues in London describe figures 10% better than that as a crisis. But whilst poor statistics is one part of the picture, there is a very human side to what is going on in our A&E departments. That was highlighted just yesterday by a heartbreaking account of one of a senior nurse in A&E department here at the University Hospital. What she documents is not about inappropriate attendances, but about the inability of the system as a whole to cope with people coming in through the door with a legitimate need. First Minister, many of these patients are elderly with multiple health conditions. What ideas does your government have to bolster primary and community services to minimise the number of that cohort of patients ending up in A&E departments?
Yes, I mean, it is right to say that bolstering primary care is a way of reducing pressure on A&E. Not for some people, of course, they will still need to go to A&E. The pressures have been there in Wales. The account that was given by the nurse is correct. There were great pressures in UHW and in other hospitals. No states of emergency were declared, that much is true, but nevertheless, the pressures were there. Now, in terms of how we deal with those pressures, you'll be aware of the primary care plan that the ministers have been promoting, and of course the need to ensure greater consistency of access to primary care services across Wales, making sure that there isn't a wide discrepancy in the services provided by different GPs, sometimes in the same town, but certainly in different parts of Wales. That said, of course, we do know that this time of year there will be extra pressure. The pressures that we see at the moment have not been seen for 5 years, and these pressures are often difficult to predict. Nevertheless, as I say, I'd like to pay tribute to the staff who've dealt with those pressures in very, very difficult circumstances for what has been a problem across the whole of this island.
Unlike your party colleagues in London, I appreciate that these are very complex issues and there is no easy one-off solution. You know that I have previously called for a commission to secure the long-term future of the NHS, which reflects how services need to change to reflect the demographic changes in our society and other pressures that are being put upon the NHS. Would you agree that we need to move forward urgently with such a proposal to ensure that we reduce the pressure on frontline medical staff who are working tirelessly at great cost often to themselves to provide patients with the best and most appropriate care that we can?
I understand the proposal that she's making. Whether she can get all parties to be part of such a commission, of course, is another question, especially as we know with an election coming in May and indeed next year. But I appreciate the sentiment behind it. I have to say, last week, one of the things that did surprise me was the comment by the Prime Minister and by the Secretary for Health in England that the NHS should not be a political football. Fine. And then proceed almost in the same breath to attack the Welsh NHS. Now, you can't have it both ways. It's important to understand that if it's not a political football in England, it's not a political football in Wales. But it is right to say that one of the challenges that all of us in this chamber will face, regardless of party, and indeed in Westminster as well, will be how to deal with ever-increasing demand with an elderly population. We know that demand in A&E has gone up by 69% in the last 10 years, and these things will need mature reflection. There is a temptation on all of us, I know, to look at health and to say, well, you know, if this was done, then everything will be resolved. It's never quite that easy. Meeting that demand in an honest way, and a commission is one possible way of doing that, I think, is potentially the correct way forward.
We now move back to questions on the paper, and this question 3 is Byron Davis.
Thank you, Presiding Officer. First, shall we make a statement on the National Transport Plan, please?
Yes, it sets out our priorities to ensure our investment in transport improves economic competitiveness and provides enhanced access to jobs and services.
Thank you very much. There is considerable concern about the deliverability of the National Transport Plan in terms of the projects being on time and prevention of overspends. If you look over the border in England, integrated transport areas and integrated transport authorities deliver clear governance arrangements and push through projects successfully. Specifically, can you outline what governance arrangements this government, your government, will be putting in place to ensure this National Transport Plan is both delivered and prevents any of the scandalous overspends outlined in the Wales Audit Office report, major transport projects?
Well, the consultation is still open. Of course, it closes on the 11th of March, and I'm sure that all will have the opportunity to put forward their views as part of that consultation. But the draft NTP interventions include, of course, a commitment to improve the strategic road infrastructure, a commitment, of course, to modernise the rail network, working with the UK government on that as well, and, of course, to ensure that we see the delivery of electrification of rail infrastructure in Wales. I have certainly not heard that the plan is undeliverable, but I'm sure the consultation responses will outline the views of those in the industry.
Alan Fred Jones.
Thank you very much. The purpose of the National Transport Plan is to create effective and integrated, safe and speedy communications between every part of the country, and you've referred to electrification, but that only has an impact on one corridor in South Wales, as we know. So is there any intention whatsoever through this plan to speed up and improve north-south links and, in fact, links between the west and southeast of Wales, because the improvements happening on the railway between Chester and Wrexham is going to cost 40 million, but won't improve that link, which is almost 4 hours between Bangor and Cardiff. So has the government any intention through this plan to improve and facilitate the connections between North and South Wales?
Well, first of all, we are in favour of that. This isn't the responsibility of the Welsh Government, but we would be in favour of the electrification of the North Wales main line. And, of course, as part of the system to consider the franchise in 3 years' time, we would have to consider north-south links. That has improved over the years. When the Assembly came into existence in 1999, there wasn't a single service between north and south. You had to wait for a long time in Shrewsbury, and that has improved a great deal over the years. And of course the plan itself and the agreements that will be considered under the franchise will be an opportunity to ensure that those connections are improved.
I was delighted when agreement was reached with the UK Government over powers for rail in Wales and the Valleys Lines electrification, but I was disappointed that there was a lack of information really on rolling stock in the National Transport Plan published some months later, and we still don't know whether we are to have new trains on the Valleys Lines or second-hand stock from England. There are overcrowding problems across Wales, as you will know, and obviously in 2018 new legislation will come in which will make some of our rolling stock not fit for purpose because of equalities. When will your government now be in a position to publish its own rolling stock strategy so that we can understand where our trains are actually coming from to run the services we would wish to see?
Well, bear in mind, of course, this is not strictly devolved, and this is something that the franchise agreement will need to address from 2018 onwards. Of course, the re-signalling work, for example, in Cardiff and the expansion of Queen Street and Central stations will give us the opportunity to ensure that more trains will be running anyway on the Valley Lines networks in the future. And of course, from 2018, we will be able to look again at what is appropriate in terms of improving and enhancing capacity in the railway pinch points around Wales. What would resolve this, of course, without any doubt, would be the devolution of the rail network, so that we have proper and full control over ensuring that we have a rail system in Wales that is within the control of the people of Wales and, of course, is properly financed to provide the service people would expect.
Question 4, Janet Finn-Saunders.
Thank you, Presiding Officer. Will the First Minister make a statement on the treatment of cardiac conditions in Wales?
Yes, the Heart Disease Delivery Plan sets out action to prevent heart disease and to provide patients with timely access to high-quality care. The latest annual report shows we are making considerable progress.
Thank you. A recent report shows too that only 38% of patients in Wales who have suffered a heart attack, a bypass surgery or angioplasty actually receive cardiac rehabilitation. That's almost 5,000 people that are missing the opportunity to access potentially life-saving intervention. Given that such a service has the potential to reduce cardiac mortality by up to 39%, what is your Welsh Government doing to increase the take-up of cardiac rehabilitation in Wales?
Well, I'm aware of the British Heart Foundation report on cardiac rehab. It does, of course, make reference to the need for further improvement in some areas. It also shows that for patients who have a heart attack and receive, I think it's primary percutaneous coronary intervention, the uptake of cardiac rehabilitation is at nearly 80%. What is now needed, of course, and we're aware of the challenge, is to make sure that good practice extends to all cardiac patients, not just those in that category.
Bethan Jenkins.
First Minister, you mentioned the report by the British Heart Foundation, and having read that report, what bothers me the most is that the death rate in the most deprived fifth of wards is almost a third higher than the least deprived fifth. And yesterday we would have seen in news reports the issue with regard to lower life expectancy in certain deprived areas of the UK, and some of those areas are featured in Wales. So my question would be how we get to grips with measuring outcomes as opposed to perhaps looking at the easier options of treatment emanating from your own action plan, given the complexity of these issues.
Well, there are opportunities legislatively, of course, through the Future Generations Bill as one example, and other opportunities as well. Secondly, the rate of heart disease in Wales has dropped significantly over the past 10 years, but there is nevertheless a discrepancy between different parts of Wales to do with lifestyle. We know, of course, that smoking is by far the biggest killer in terms of heart problems and other problems as well. And of course, issues such as too much alcohol, diet, and they're factors that are linked to poverty, that which is true, or partially linked to poverty. We would expect, of course, the local health boards working with primary care providers to look to address those issues in the future, to close that gap, to make sure that we do not see that kind of gap in the future in terms of heart disease between different parts of Wales.
Question 5, David Ellis-Thomas.
Thank you, Dame Presiding Officer. When will the First Minister hold his next meeting with the UK Prime Minister?
Well, I don't have any plans at present to meet the Prime Minister, but I'm sure that there are other things on his mind between now and May.
I was very pleased to welcome the First Minister on his visit to open a new turbine in Dolgarrog recently, when he made some important statements on renewable energy. But isn't it about time that he managed to persuade the Prime Minister of the United Kingdom that we must see the devolution of permissions powers for planning for energy developments in Wales before the St David's Day agreement between the parties here in the Assembly and the parties in the government in Westminster?
Indeed, this is Welsh Government policy which is shared by a number of members in this chamber. We are not eager that the people of Wales should not have control over the natural resources of Wales in the same way as the people of England, Scotland and Northern Ireland. This is imperative before any agreement is signed on St David's Day.
Nick Ramsey.
First Minister, when you do finally get to meet the Prime Minister whenever that might be. I'm sure you'll be discussing the preparation for the devolution of taxes to Wales in 2018, fast approaching now in the wake of the Silk Commission. Will you also raise with the Prime Minister the need for close cooperation during that process, because I'm sure you'll agree this is completely uncharted territory for the Assembly, and there is a need for a close involvement of the Office of Budget Responsibility, and also a need to discuss with Westminster potential for tax avoidance happening within Wales, within a newly devolved tax framework, and the need for you and the UK government to make sure that certainly doesn't get tax devolution off to a bad start here.
Well, yes, I mean, members will have heard me say on many occasions that the issue of Wales's funding needs to be addressed first before considering how income taxes and in what way income tax powers might be devolved in the future. Of course, we know that Part 2 of Silk was provided the text, if you like, in terms of further powers for Wales. I have to say that the Smith Commission's recommendations have certainly thrown much of Silk up in the air. And, for example, air passenger duty being devolved to Scotland, not to Wales, is highly discriminatory and something we could not possibly tolerate. That said, I do believe that with the right level of flexibility on both sides, there is the opportunity of an agreement by St David's Day. The issue of underfunding must be agreed and addressed. Issues such as APD have to be dealt with. Long-standing issues such as the devolution of energy consents, already mentioned, they have to be agreed as well. I think with a level of flexibility, there is scope for such an agreement.
William Powell.
Diolch, Llywydd. First Minister, it was my privilege to join you, the Secretary of State for Wales, and colleagues around this chamber at the rally that you referred to earlier in response to Andrew R.T. Davis. And clearly the attack on the Charlie Hebdo offices and the associated massacres in Paris that took place last week certainly served to renew the debate about managing extremism and dealing with the consequences of alienation that was referred to. In that context, First Minister, will you commit to seeking a meeting with the Prime Minister to discuss the development of the anti-radicalisation programme, particularly drawing on good practice that already exists here in Wales, such, for example, as the Mosaic programme that has been rolled out by the Welsh National Parks, which has brought great benefit to members of the ethnic minority communities from the great cities of Wales, enjoying and benefiting from the experience that is afforded to them.
I can assure members that much of that work is carried out by individual ministers dealing with their Westminster counterparts on as it were, a day-to-day or week-to-week level. I have met with the Prime Minister on several occasions over the course of the past year, although not on a one-to-one basis. We do get the opportunity to touch base on issues, as we did before Christmas. It is not common for the Prime Minister and myself to meet. Usually these matters are, on these issues, dealt with by individual ministers, but I can assure members that they are dealt with.
Question 6, Elin Jones.
Will the First Minister provide an update on the government's plans for rural payments following a decision to quash the separate payment for moorland?
Well, the arrangements for the basic payment scheme in 2015 are dependent on the payment options chosen. Modelling work is underway, and this will be first discussed with the stakeholder modelling group this week. When finalised, we will, of course, hold a public consultation.
First Minister, you will be aware that before Christmas a High Court judge actually quashed the decision on separate payments for moorland farmers. Now, exactly a year ago, we had a statement from the then Minister on changes to the single payment, and a year later, we have this week seen another statement published by the current Minister saying that we had to start from the beginning once again, and both ministers had adequate warning that the decision on the 400-metre line was an arbitrary decision and an unfair decision. There is a real risk now for your government to be able to make these payments in December of this year. And therefore, can I ask you the question, what additional resources are you as a government providing now to the Agriculture Department to ensure that decisions and measures are put in place to ensure that payments are made at the end of this year? Because we don't want to find ourselves in a situation where Welsh farmers have to pay the price for the failings of your government over the past year.
Well, first of all, may I say that the same amount of money will be available. And so in that system, some will benefit, some will gain, others will lose out. As regards the payments themselves, may I say, we're still aiming to pay in the window, which has been our custom for a number of years. And we must ensure, well, the member is answering the question herself. We're still aiming to make the payments within the window. And we realise how important these payments are to farmers, considering the pressure in the dairy sector, and we have a good track record under a number of ministers of agriculture of making the payments within the window.
Can I thank the First Minister for the government statement yesterday on basic payment on the basic payment scheme. It's clear from that statement that time is constrained and that there is going to be a financial impact for farmers at the start of the next window in December. So can I ask what time frame the government is realistically working towards to generate and gain approval for the new payment scheme options, and what contingency plans you're working on now to minimise the payment impact at the end of this year?
We are aware of the potential impact, and we are working to make sure that there is no impact and that those payments are made on time. As I said to the member for Ceredigion earlier, we do understand how important it is for farmers to receive that part of their income, and of course to enable us to keep up the good record that Wales has had over the years in paying on time.
Aled Roberts.
Thank you, Presiding Officer. First Minister, you accept these payments are important, and the Deputy Minister's statement has made it clear that there is a risk now that these payments won't be made in December 2015. I think what farmers need to know is the specific government timetable so that they can plan proactively, understanding how much they depend on this funding. It's the timetable that's important. We accept that you have to consider the options, but farmers need to know exactly when the government will make a decision as to which option is to proceed, and also when you will know exactly whether there is a risk that the payments aren't to be made in December.
The data modelling group will consider the options in 3 days, and then there will be a consultation on the new options, and the target is that that should start in March. And so there will be an opportunity to ensure that the new system is in place and ensure that the payments will be made at the end of this year.
Thank you, Presiding Officer. First Minister, with a timetable of March, business plans that farmers made many, many months ago based on the announcements of the previous minister are now being ripped up and put in the bin. Their businesses are being impacted, and what's more, farmers are being told not just that there's a delay, potential delays in payment, but actually that their payments are going to be potentially reduced from the business planning that they did previously. Isn't it time, therefore, for you to reconsider at the same time your 15% modulation in order to mitigate that impact on Welsh farmers? Because once again, Welsh farmers are in a position where they are worse off than their competitors, not only in the rest of the UK, but also in Europe.
Well, I mean, first of all, let's bear in mind that any system that is different from the one that was proposed is bound to see some people winning and some people losing. That's inevitable with any new system. But of course, we'll have to wait to see what the consultation responses are in March. But businesses base their business plans on what they think the price of their product is going to be. And it's important that as we look to see farming become more sustainable in the future, that we provide farming businesses with the opportunity to become more business-oriented than they are now, having to rely less on subsidies, which are important at the moment. Businesses in Wales, farming business, cannot live without them. I know that full well. But it's important that we improve the sustainability of farming businesses in the future, and the money to do that comes, for example, from modulation, to make sure that farming becomes less reliant on public subsidy and is able to ensure that farming becomes more robust and reliant on the market in the future, as any other business does. And so modulation, I have to say, provides the money in order to do that. But I do take the point that it's exceptionally important to provide certainty as soon as possible.
Question 7, Mike Hedges.
Will the First Minister make a statement on the Cardiff University School of Medicine study into the lifestyle habits of men from Caerphilly?
Well, it's a very precise question that the member asks. The study does provide hard evidence that a healthy life improves people's quality of life and, of course, lowers their risk of developing chronic illnesses. I believe that the Minister did make a statement on this at the end of November last year.
Thank you, First Minister, for your response. I'm obviously pleased when a study comes up with it and says exactly what I've been saying for some time. The report highlights the importance of lifestyle, especially the benefit of not smoking and exercise. What action is the Welsh Government planning to get people to improve their lifestyle?
Well, the public health white, I mean, in some ways, I suppose the study told us, or confirmed what I suppose many of us would already know. But the member asked rightly, what is the government proposing to do in response? The Public Health White Paper, of course, gives us the opportunity to take forward legislation that will help to improve public health, whether it's through smoking or through alcohol consumption. And, of course, there are other possibilities that exist through the Future Generations Bill. They have already been put forward in terms of the Children and Families Wales measure, the Rights of Children and Young Persons measure, and, of course, the Healthy Eating in Schools measure that was implemented in 2013. So a number of legislative actions have already been taken. There are still opportunities that exist, particularly through forthcoming legislation, to help to address the problem of poor lifestyle and, of course, to help to close the gap, as already mentioned by a member opposite, between different parts of Wales when it comes to healthy life expectancy.
First, you'll recall that this unique study showed that following 4 or 5 health steps, balanced diet, exercise, not smoking, healthy body weight and low alcohol, resulted, as the Minister gave in the statement, that there was 70% less likely to have developed diabetes, 60% less heart attacks, 40% less strokes, and 60% less chance of developing dementia. A really interesting study. Sadly, living well, living longer, produced recently, seems to suggest that we're not living any more healthily than we were in 1979. What does the First Minister intend to publicise these good measures? We have a more healthy 2015.
Well, of course, the rate of the drop in heart disease would indicate certainly that there have been successes in terms of promoting better lifestyles. There are still challenges. I mean, the rate of smoking has dropped dramatically compared to what it would have been when I remember as a child, when it was almost compulsory in almost any public building, when even in hospitals, doctors would walk around with a pipe in their mouths. Those days have changed, thankfully for the better. People are far more aware of the dangers of alcohol consumption than they were, although the issue of binge drinking remains. And, of course, the issue of diet is linked to income, and that is something, of course, that can be quite difficult to break. That said, we've been promoting exercise now for many, many years, and the fact that we do see the drop in the rate of heart disease gives us cause for optimism that the message, although not perhaps fully implemented by everybody, is much better understood.
Lindsay Whittle.
Well, First Minister, people, of course, don't respond to being lectured about their health by politicians and the so-called experts. My personal bad habit of eating my own body weight in cheese is now under review. But seriously, what efforts will the Welsh Government be making then to arrange for men who took part in the Caerphilly Health Survey to visit schools and further education colleges to spread the word amongst the young people about the huge benefits of living a healthy lifestyle? It may be too late for some of us, but it's not too late for our young people.
I do sympathise. I'm sure that help is available for the member to deal with his unfortunate condition. But I think it's an important point. I think with young people, of course, they're far more aware now in terms of the curriculum, whether it's in terms of what they are taught in terms of design technology courses, in terms of food technology, what they're taught in PE these days. I mean, PE was, go and run around the field and kick the ball around. Now there's much more thought given to how the body, the physiology, than was previously the case. And, of course, the decisions that have been taken with healthy eating in schools, with the measure to make sure that foods are healthier in school and that young people are more aware of the need to eat healthily. Difficult, of course, to combat advertising and peer pressure in terms of what of the availability of fast food much more widely available actually than it was in the 70s in terms of some of the companies we have in Wales now that weren't here in the 1970s. But that said, I do believe that the message is certainly understood. The next step now, of course, is to make sure that the message is actually implemented.
Jeff Cuthbert.
Diolch, Llywydd. First Minister, will you agree, join me in congratulating Dr Peter Elwood, who's led the 35-year study, and the large cohort of men from Cyflwynir, most of whom are my constituents. And do you agree with me that indeed if these 5 key steps, and we've mentioned smoking, lowering alcohol intake, maintaining a healthy weight, eating a balanced diet and exercising, were indeed followed more generally, it would not only lead to a healthier and better lifestyle for most people, but of course could significantly reduce the costs for the NHS?
That has to be self-evidently true. In many ways, the study is very different because it's such a long study for such a long period of time. And it does confirm what many have believed, and that is that lifestyle has a strong effect on not just on life expectancy, but on healthy life expectancy. And the measures that I've already outlined, both legislative measures and, of course, the other measures through regulation, are having an effect, we believe, in ensuring that the results of the study are acted on. And, of course, the Minister made that statement at the end of November in response to the study.
We now move to item 2, which is a business statement.